Today on Substance Stories, we're going to be talking about DBT, how it works and how it can help you. Nathan, great to have you back on the show. Today we're going to talk about DBT. So DBT is a very well-known psychotherapy created by Marsha Linehan in the early 90s, based off Hegelian dialectics, as I'm sure you know. Are you sharp with your Hegelian philosophy, Nathan?
I'm very good with my dialectics, Rich. Yeah.
I don't even know if it is based off Hegelian philosophy. So I think it is. That was a big call. Tell me a bit about DBT. What is it's you? It's got four main categories. What are they?
Yeah. So DBT is based on four main categories, I suppose, four main skills, mindfulness skills. So it's quite big around, being mindful around not just, things around you, being present, but also being mindful of your internal processes. So one of the main skills within mindfulness that underpins all the other skills is mindfulness of your thought processes. So there's this underlying philosophy. We all have this inner wisdom within us called the wise mind. And to get into that, we often have to balance the kind of extremes, the emotional mind that drives emotionally charged behaviors. For some people, that could be drug use, it could be aggression. And then the other part of the mind, which is like they call it the reasonable or the rational mind, which is pure logic without any kind of emotion or, taking into consideration your values. So there's this mindfulness category. There's interpersonal effectiveness. So how to be, effective within your relationships. So there aren't these kind of ongoing consequences of dysfunctional patterns in relating to other people, which often can underpin substance use for some people. Then also emotional regulation. And last one is distress tolerance. So how to deal with distress without acting in a way that makes the next situation worse than you were before.
Yeah, and so as I said, it was come up with by Marsha Linehan specifically for borderline personality disorder, but it's actually got, as you've touched on, an excellent evidence base for treating substance use disorders.
Yeah.
Why do you think that is?
Look, originally it was made for borderline personality disorder, but more so to deal with extreme kind of suicidal behavior. So to deal with behaviors that cause a lot of harm to the self. So here are these skills to assist you if what underpins your behaviors within your diagnosis of borderline personality disorder, if it's conceptualized as emotional dysregulation. So for substance use, look, not everyone's substance use is underpinned by emotional dysregulation, but for a large cohort, it is. So, what I mean by emotional dysregulation is not being able to tolerate your emotional experiences and looking for maladaptive coping strategies. For some people, that way of coping and surviving is using substances to deal with their emotions. So, if that is what your primary way of regulating, then DBT says we can offer you some additional skills to meet that need because for these people, it's meeting a need. Substance use is allowing you to function in the world in some capacity, despite the negative consequences. So here are these other
Absolutely.
skills that we can give you to actually tolerate your emotions.
Absolutely, and I think that's so key. I think the way both of us think about addiction and addiction recovery is acknowledging what the addiction is doing for you, right? Because I think it's so often missed when people talk about recovery is, well, this is making your addiction's making your life worse, and so you've just got to stop. But what the person here is, well, the one thing that's helping me get through the day, you want to take away. It's helping you get through the day, but it's destroying you tomorrow. And so what we need to do is not only get rid of the addictive behavior, but bring in something that helps you get through the day. And I think that's the beautiful part of the, especially the emotional regulation parts of DBT. But also, I think you could say in the interpersonal effectiveness, and we touched on dialectics, people with BPD and people in addiction can get caught in black and white thinking, and I think it's so key as part of addiction recoveries and recovery from BPD is seeing the grey in the world and holding on to that dialectic would be what they're saying, as in you do this podcast with me, but hate my guts, but you can hold that dialectic.
Yeah, exactly right, Rich. And like one of the dialectics about like, it's kind of a good saying. I use it sometimes with clients. It's like, um, you know, if you're trying to swim, right? Like you could be trying your hardest to swim, but you need to try harder not to drown, right? So if you're a person that hasn't grown up swimming, right, you never spend a lot of time in the water, throw you in, in the water in the pool, um, you could be trying the best you can right now, and at the same time, you need to try harder so you don't drown
Mm.
because you haven't had those skills to swim. And it's the same thing with the kind of with our clients, like it's like holding the dialectics and explain to them, you are trying the best you can, and at the same time, here are some skills you might need to be able to function in the world in the best way possible for you to have a meaningful life. So that's holding those dialectics because often people can put themselves down of, I keep relapsing, I'm not trying. And I'd say, I disagree. You keep coming here and you're trying really damn hard.
Yeah.
At the same time, maybe there's some more work we need to do for you to actually reach your goals and live the life you want.
Yeah. Yeah, I mean, as I think you touched on it there, but the key dialectic in an addiction is everyone that is seeing me for their addiction does not want to be in an addiction, but also part of them wants, like, part of addiction is you want to continue in that addiction. That's the key, um, dialectic of addiction. I think the other thing I wanted to talk about, because you touched on it before, is self-harm as an addiction, which there's quite a lot of literature that talks about non-suicidal self-injury is an addiction. I really like that, as in it is something that is not helpful for us, but it removes the pain of existence from us, which I think is a really wonderful way to think about self-harm or think about an addiction. Is this is something that we know isn't good for us, but is removing the pain, which is a very interesting concept.
And that's the thing with, like, regardless of, like, talk about borderline personality disorder or just emotional dysregulation, for this population that have chronic, self-harm, what they often say is, um, that they're in that much emotional pain that cutting, which is physical pain, is more bearable. So therefore they cut to
Yeah.
stop feeling those emotions. And that tells you a lot about the world of pain they're actually living in, right?
Big time. I mean, and that's the key of addiction. People with an addiction aren't using to have a good time. They're using to not have a bad time, right? And that's it. That same cutting is, I'm in so much pain. I'm engaging in a behavior just to remove pain, and that is what's driving this. One thing I want to talk about now, because it's something that really annoys me with DBT, is if you look at proper DBT, right? That should be a group session a week, an individual session a week, and a phone bank, and a course of DBT should last 6 months, right? That is what most research is based on. That's what Marsha Linehan wants. How much of that is actually out there? I have people coming to me all the time that say, "Oh, I've done a DBT," and have they? How many people have you met that have done DBT in society for 6 months with a phone bank and 2 sessions a week?
Look, there are some people I have, and I've worked in places. I've done like a placement as well in places that have done that. Um, but often people just focus mainly on the skills. So the skills are like one part of it, which are kind of what we teach and like what we kind of. It's not very process driven. It's not like working with what's in the room. It's very kind of like you're in class and we're teaching some skills, right?
Yeah.
That's definitely, I suppose, easier to integrate. But yeah, like you said, a lot of the research is based on the comprehensive DBT model, which is quite rare, especially in I suppose public, more accessible settings. There are some places here that offer it. For
Yeah.
example, Spectrum offer it.
Spectrum, yeah.
Yeah, and there are a few
There are a couple of private hospitals in Melbourne that will do a 6 month group
yeah,
and individual, but they won't do the phone bank.
yeah. The phone thing
And
is
I
a
guess
bit
I guess
tricky. Yeah,
Well, to me, and I think about this a lot, because the phone bank, just sorry to explain to people. So proper DBT is a group session, and that's where you really work on that interpersonal effectiveness, because we're feeling the group and the group grows together. So we can think about peer support groups, which Nathan and I have talked about together before on this podcast. The skills session, which is a one-on-one skills session, is where you learn things like tips, which is a great emotional regulation tool, and a phone bank coaching service. That's when I'm feeling emotionally dysregulated. I'm thinking like I want to self-harm. I call up. It's not sort of counseling, it's coaching of the skills. And I often think about the role of a sponsor in addiction recovery and the role of a DBT skills phone bank. Have you ever made that comparison before?
I've heard that before. I definitely agree, Rich. And I was actually I was talking about the role of a sponsor as a coach the other day in group with the patients because I was saying like no therapist within Australia will answer the phone for you at 11 p.m. when you're overwhelmed, you want to use, you're in chaos, you're in crisis. A
Mm.
sponsor will, they have that rapport with, and it's within the boundaries of your kind of working sponsor-sponsor
Yeah.
relationship. But no therapist here will do that because often, within our kind of guidelines and the sense of
Sure.
risk, therapists are quite hesitant to do that.
Mm.
Um, Even though, like, if you look at DBT, that's part of the model, that's, yeah. So I see what you're getting at, and I think that's where the kind of, yeah, um, here are the skills, but are you actually implementing them? And real
Yeah.
time situations, how we can coach you to do that is helpful. But then it's reluctance because of therapists not wanting to hold that risk, I think.
Yeah, and it's obviously, an incredibly expensive thing to have I mean, I think it should be 24/7, but often people just say it's, several, 10 to 10 or whatever. But I think there is one of the things that why I raise the sort of thing is I have a lot of people tell me, "I've done DBT, it didn't help." But when I feel out they've done like a 12-week group only or a 12-week skills only DBT program, I'm like, that's like saying, I've climbed Mount Kilimanjaro because I went through, an airport in Tanzania in my mind. It's just not the same
It's
thing.
not the same thing.
Uh,
It's not what the evidence is based on. And also, what I hear a lot is, I know the skills, they don't work. It works. Look, they work if you work them. I
yeah.
always make the
Yeah.
comparison of, if a psychiatrist prescribes you medication and you go pick up your medication and you keep that in your pocket, right? You haven't taken your medication. It's not going to work until you actually consume it. It's the same thing with the skills. I can sit here and, Rich can sit here and we can talk to you about the skills, teach you the skills. Unless you're actually using them, you're not actually engaging with them. You can know the knowledge, but if you're not applying it, it's the same thing as keeping your pills in your pocket. You're not going to get any benefits from it.
100%. 100%. I know how to run, you run marathons. There is a very big difference between the two of our fitness levels, right? um, do I know how to run though? That's possibly a lie. So hopefully that was a crash course about DBT. We've now covered schema, ACT, and DBT, which is great. Then we cover MBT, and we've covered the full gamut of sort of the best evidence-based psychotherapies for BPD, which is fantastic. And we've done our BPD episodes, so it's covering the whole gamut. Thank you so much for joining us, Nathan, for another excellent episode. I'm sure I'll see you back soon.
Catch you later.